Ms. Joan Pereira.
Question 2, sir.
Mr. Speaker, may I take question 2 and 3 together?
Yes, please.
The incident rates of active tuberculosis cases in 2017 and 2018 were similar at 39 cases per 100,000 resident population. In fact, the rate had remained within a stable range of about 37 to 41 cases per 100,000 over the last 5 years. In 2018, almost half of new active TB cases were aged 60 years old and older, although their incident rates had also remained stable. Many older Singaporeans were exposed to TB when they were younger, when incident rates in Singapore were much higher. As such, up to 30% have latent TB. Latent TB patients do not exhibit symptoms and are not infectious, but 1 in 10 may progress to active TB during their lifetime. The World Health Organization and local experts do not recommend population-level preventive medication to treat latent TB. Those with active TB and recent latent TB infection will be treated with medication. The treatment approach for older Singaporeans is the same as for the general population. To contain TB transmission, the Tuberculosis Control Unit conducts contact investigations to identify persons who have had close and prolonged contact with infectious TB cases. Contacts are tested for TB for early detection and treatment of the disease to prevent its spread. MOH launched the TB Clinical Practice Guidelines in 2016 to strengthen TB management. For multi-drug resistant TB, patients are isolated for treatment until they become non-infectious, which takes about 2 months, and they will undergo directly observed therapy for about 2 years. We have also adopted new technologies such as rapid DNA tests for drug resistance, reducing time taken for identification of MDR-TB from 2 months to a few hours to facilitate early intervention.
Ms. Pereira.
Thank you, SPS. I have 2 supplementary questions. First, will the ministry consider setting a public target to be achieved for TB control? Second question, what are other plans that MOH have in improving public education and awareness of TB, especially among our elderly? Thank you.
Due to the previous exposure when TB rates were quite high in the 1950s and 60s, there is now a fairly significant number of older Singaporeans with latent TB infection. Waning immunity in older adults also contributes to reactivation of this latent TB later on in life. Hence, it is quite difficult to set a firm target to achieve the firm TB control, but in the longer term, our goal is to benchmark ourselves against high-income countries that have TB rates of about less than 20 cases per 100,000 population. As for the strategy, we adopt a 3-pronged strategy towards reducing TB incident rates, and the first strategy is to improve public knowledge of TB. Besides information on MOH web pages and press releases, HPB also runs campaigns. Social hygiene campaigns called Fight each year, and this is aimed at promoting good hygiene practices and help prevent the spread of infectious disease. So exhibitions are conducted at Tan Tock Seng Hospital on annual World TB Day to educate the public. The second strategy is to educate healthcare practitioners about current practices in their diagnosis and management of TB. And towards this end, the Clinical Practice Guidelines were launched in 2016, and this contains information on TB diagnostic tools, treatment regimes, and public health measures for TB control. And finally, MOH is also reviewing its policies and measures to increase early detection of active TB.
Mr. Melvin Yong.
Thank you, Speaker. Thank you, SBS, for the answer. I have a couple of follow-up questions. I think first, based on the case data, does MOH know at what stage do TB patients, especially the new cases, at what stage do they seek medical consultation? Is it early on or is it later on? Because that follows up with my next question, are your current public awareness, current measures to contain local cases effective? Of the 1,565 new cases reported last year, 2018, more than two-thirds, or about 1,130, were at least 50 years old, and more than half of these were males. So I'm not sure whether some of the efforts can be more targeted to focus on these vulnerable and higher risk groups. And my last question is, with an aging population and based on what you just said, would MOH expect the incidence rate to continue to increase because of our aging population?
I do not have the information on the stage at which the TB cases are detected. On the second point on what will be done, we are constantly looking at ways to improve, and as for how extensive or how bad it can get, well, I think it depends on the effectiveness of the strategy that we've implemented. We are promoting, as I mentioned just now, the three-pronged strategy. So if we stick to that strategy and everyone cooperates, I think we stand a better chance at controlling this transmission.
Dr. Lilino?
May I ask SBS, how big is the problem of drug resistance to tuberculosis in Singapore? Have you done any studies on that? And whether MOH is using any new drug cocktails to overcome this problem? Thank you.
I do not have the information on that. Perhaps the member can file a separate PQ on that.